There you go. All right. And then I'm going to start sharing my screen. There you go. All right. So do you guys see the,
Yes.
okay. So
Yeah.
to start off, if you guys can, mute yourselves so that, if you have, any questions, you can always put it in the chat. I'm sorry. The reason why I'm looking at the screen because there are some people that is requesting to get right, so that's why.
Can't get in.
All righty.
So you have to let them in individually.
Yes, I do. All righty. So do this. Good. So probably most of you know who I am, but just for those who don't, I am LJ Brooks. I have a 24-year experience as a physical therapy. And yes, it says Doctor of Physical. It's just supposed to be Doctor of Physical Therapy. I'm also an APT, American Pelvic Floor Therapist, and I'm a certified lymphedema therapist. And the reason why I feel empowered to discuss to you osteoporosis is because I'm also a bone fit certified clinician. So if you look at the trifecta, those are common conditions. Yes, those are the common conditions. Somebody. Yes, definitely, Miss Cece. That's going to be part of the agenda. So pretty much one of the things is I want, to empower women to basically learn about different conditions that affect their daily lives. And I feel like the more we know, the more we do better, right? So one of the things that I also want to share with you, which is I'm very happy about, is I just recently opened my own practice. I'm the owner of For Life Healthcare LLC. It has a soft opening in September 9, and we have a brick and mortar location, and that is by Ashbrook Commons Plaza. For those who are familiar, right, Nana? And the specialty is really for women's specialty programs such as pelvic floor. Patients have specific diagnosis for osteoporosis and lymphedema. All right. So for today's agenda, question for everyone. Which woman do you think is suffering from osteoporosis with the three pictures that you guys see?
The last one?
1, 2, 3. So the last one. Does everybody agree?
I mean, the first one.
The first
one. Well, the one to my right.
Oh, okay.
I would say
the incrementing heights, right? So is it
Yeah.
the tallest or the shortest?
I think the middle person is the one starting.
The middle person.
Middle? Okay.
Middle, okay. So everybody wants to interject, has a different opinion? Actually, one of the myths is all of them have osteoporosis.
Oh.
Yes. So, and that is one of the things that is kind of when I was training to be a bone fit clinician, that kind of was mind-boggling because I thought like, wait a minute, I thought only anybody above 50 would have a diagnosis of osteoporosis. So based on how they study about growth and development, our peak for bone mass is actually it reached about 90% of it will be up to 20 when we reach 20 years old, and the remaining 10% will be up to 30. So it means after 30 years old, that's when we start losing bone mass. So but there's always a silver lining on everything. That's why the agenda for today is what are the truth about osteoporosis. We're going to talk about probably different demographics about osteoporosis. It is very important for us to really pay attention to our bones because our bones is basically our framework, right? So we were also going to discuss BMD test, which is your bone mineral density test. We will explain what a DEXA scan means. We will also talk about your fracture risk. So if you don't have any access, or, like most doctors doesn't really give you your DEXA scan because of your age, there is such a thing as a FRAX score that is free that we can always, get access to. We'll also talk about postural training, spine sparing, hip hinging, and of course, the most important thing, that is our activity plan. Like, how do we move forward from having this knowledge to be able to, how are we going to change, ourselves moving forward, right? So that's the important thing. And I'm really excited to get started. Are you guys ready?
Ready.
All right.
Yes.
All right. So the truth about osteoporosis. So always remember that osteoporosis does not have any single cause, right? So it's not genetic. It's not because of your diet. It's not because of your movement. All of them are basically, factors overlapping from each other. So if we change our diet, if obviously we cannot do anything about our genetics, right? Change our movement, all of those will actually in return will improve our bone density. And it is also called a silent thief. So one of the key things is because it doesn't have any symptoms. Sometimes you have osteoporosis, you don't even know you have it up until, you were lifting your laundry one day, turn, and then you hear a crack, right?
Ugh.
So we don't want to wait for, we don't want to, for that situation to happen. That's why you guys, you took the boldest step, and that is to create awareness about the condition. We also want to talk about men versus women demographics. So another myth that we want to debunk today is men get osteoporosis, but not as frequent as women. Women is basically for 1:2 women will have osteoporosis past 50 years old. For men, it's basically 1:4. So they do get it, but not as prevalent as women. So the other thing that, there's so many lists in terms of demographics, but one of the things I want to highlight is 80% of the hip fracture is osteoporosis related, right? So it means if any hip replacement, most of the time, 80% of those is because they had osteoporosis. And two things we have to also consider, that is the human cost, and then the actual cost of how much is our healthcare, how much are we spending on healthcare when it comes to managing osteoporosis. 54 million Americans are at risk to actually will be at risk for having osteoporosis. 54 million, almost half of the adult above 50. 5.7 billion is the actual cost. And this study is back in 2016. So because of inflation, this number probably would be a little bit higher, right? So it's, these numbers, it might sound scary, but at the end of the day, we are aware that, what is happening. But, if because you are here at the workshop, it's always good to kind of tell other people that there is something that we can do. There's also one thing that I'm going to talk to you about, and that is the Lift More trial, where the BoneFit program actually evolved. And the other thing about osteoporosis, do you see the picture that is attached to this slide? Do you guys see the picture?
Yeah.
Yes.
Okay, so basically, this picture, I want you to pay attention to the one that's highlighted, standing, right? So standing, it means 100% of load. If you lean forward, even without weight, that will, give you 150 or 150% of the load. So how many people do you see that, that walk or even stand that way? So it means you're already, putting too much load on your spine by just leaning forward. And not to mention, if you're, putting weight or lifting weights, doing deadlifts incorrectly, that will give 220% of loading on your spine. So let's not do the weights, but let's go pay attention to the most common thing that we usually do. Do you see at which position is at 140?
Yeah.
Yep, sitting,
Yeah.
right? Not even leaning, you're just sitting straight. So the reason behind that is because your load doesn't go all the way towards your feet, right? So this is the loading. So as soon as you sit, that is really, pretty much bad for your back. And the other thing is because the load hits your pelvis, which is, when you're sitting, therefore, most of your load goes to your back. But what happens really is when you lean forward, right? So when you lean forward, and this is a common position that we do when we're on our workstation, right? And yeah, it increases your load from 140 to 185, right? So you're like, this is kind of like, an eye-opening. So one of the key things is we know, like I said, the key to, making a change is awareness. So we are aware what all of these, cumulative daily tasks is, doing to our back. And now we wonder why, we have back pain, right? So understanding that there is a solution to all of this, right? So let's get to this one. Self-assessment and important findings. So one of the key things that we have to learn is how do we get a diagnosis, right? First thing is, getting a DEXA scan. That's your bone mineral, density. And it actually assess your T-score on your hip, common area, and then your spine, specifically your thoracic spine, which is your mid back, right? So one of the key things for the DEXA scan, we're actually going to talk about the assessment because I have another picture to explain what a T-score looks like. Okay, so again, step one is your BMD, just to get that diagnosis. And these are meant for women and men that is above 50. Your doctor can prescribe that to you, primarily with those, that already have genetic history of osteoporosis. So let's just say you're not 50 yet and you feel like, can I get tested? You can. However, there's also another test that you can take that is actually for free, right? And that is your FRAX score. So if we click this, so basically your FRAX score, that is your fracture risk assessment tool. And you have the link on the email that I sent you. You can always go through the exact same link. So basically this link, yeah, so obviously they got the flag. So the test is from Canada. So basically it identifies your age, right? Your sex, male, female, your weight, your base, your BMI, if you have a previous fracture. So it is a questionnaire. And the great thing about that, so obviously it will ask how much alcohol you drink in a day, and then if you have any secondary osteoporosis. So again, those are diagnoses that you have to be aware of. If you're diagnosed with rheumatoid arthritis, if you're currently smoking, if you're taking any steroids, right? If you have, any parent that had a fractured hip, or you had a previous fracture. So those are the parameters to actually, that's part of the questionnaire. And if you have all the answers to this question, then you can hit calculate and it will give you your risk. So this will give you an absolute 10-year risk probability to have a fracture. So pretty much that's, how highly competent this test is. So I would suggest, at your own time to check the FRAX score. So at least you'll have an idea like, oh, okay, and it runs by percentage. When you hit calculate, it will give you 7.7 percent. So that's the percentage of you having a fracture within that 10-year mark. All right, so if you want more information about how to how to different or how to answer the questionnaire, you can always reach out to me. Okay, so let us go back to the presentation. And this is you always hear osteopenia versus osteoporosis, right? So osteopenia is basically the precursor of osteoporosis. What it means is if you look at, I'm not sure if you guys can see the green, yellow, and then red colors. Yes. So that is your T-score. So it actually checks. So whenever you get a DEXA scan done, what's going to happen is every time you see a negative, that is not good, right? If you see a positive, so it's just like that. If it's negative, not good, positive, good. So if you see between a -1 to -2.5, you can see that yellow. You have a low bone mass. So that is equivalent to having osteopenia, right? So if you have anywhere below -2.5, that is equivalent to osteoporosis. All right. So that's how you can, differentiate between osteopenia versus osteoporosis. So is there such a thing like, can a person skip osteopenia and go straight to osteoporosis? Possibly, yes, because what if they haven't been tested for a long time and they got, they have back pain and they got tested? Yes, most definitely. So that's why early testing is the key. Don't be scared to know. Like, I have a patient, like, I don't really want to know my result. But at the end of the day, knowing what you have, you can actually do something and prevent it from any further damage. So one of the key things, that's why it's good that you guys are here, because that's the whole program. The whole program is how are we going to be able to slow down the progression of osteopenia to become osteoporosis, or how can we have the osteoporosis patient reverse back to osteopenia and finally to have a normal bone density. So we are going to, and if you have any questions about the DEXA scan, or better yet, if you guys have any DEXA scan and you want me to do an interpretation, and we can walk through it and probably identify any information, like I said, my email, you can always send me an email or a text message.
Sounds good.
At the end, we'll actually have an actual Q&A section. So all those people that, because I've been seeing questions on the chat, I will go through all of them before we end, okay? All right, so recommendation, how do we prevent future fracture? There is a mantra with bone fit clinicians, and that is, how are we going to make our patient too fit to fracture? That is kind of like my mindset. I want to make sure that 54 million, at risk, I want to be, one patient at a time to learn all about how can we reverse, osteoporosis. So one of the key things, and there are several, that's why the workshop is a series. It's not like, oh, how can we fit everything in a 30-minute, workshop? It's going to be challenging because there are a lot of moving parts, right? So one of the key things we have to take notice, what can we do now? What are those low-hanging fruit? And that is your posture. You don't need an equipment, right? All you need is to be aware about that, be aware of how you're, keeping yourself up in terms of your posture, maybe sitting, picking up something. And that's why for me, I could probably start with strength training, going to the gym. But at the end of the day, if you don't have alignment, right? That's why it says alignment is more important than intensity. You want to focus on the quality of how you're keeping yourself up in terms of all the gravity around you. Okay. So postural training, spine sparing, alignment is more important than intensity. So let's go check certain things that is important on postural training. And the very first thing is breathing. So you might say, breathing. Why breathing? Because again, when you have a bad posture, so I'm gonna try to be devil's advocate and mimic how I'm actually sitting. So if your posture is in a slouch posture, right? I can see almost everyone is like, I was like, okay, good. We're learning. Okay. So one of the key things is when you are in a slouch position, and I can't blame you, when we look forward, right? When we look down, our head is heavy. So our tendency is our neck is going to go down, our shoulder is going to follow, our chest is going to, it's going to shorten. So it's hard to expand. That's why when you try to push your shoulders back and try to feel like you're getting pulled from your head, like you're a doll, right? It feels different. It feels like, wait a minute, I feel like I'm 2 inches taller. So that's why even if I'm 4'11" on a good day, I always feel like I'm 5'11" like my husband. But it's always about how you carry yourself, right? That is the very first thing. How do you carry your head? Are you imagine that you're pushing your head against the wall? That's how you could, don't look down, always try to be on a neutral head. And then the other thing is your shoulder. If you feel like you can push your shoulder like as if you're cracking, an egg in between, your shoulder blades, that's how you're going to push that and improve that posture automatically. And then the other thing is how you're carrying your abdominals, right? So you have to start with breathing. So I want everybody, if you're leaning, if you feel like you're not in a proper posture, try to change that. Okay, so let's all start with our proper breathing technique. Okay, so the first thing that we need to do is let's put one hand, it doesn't matter if it's right or left, put it on around your chest. And then the other hand, you're going to put it by your belly. So for those who are my patients, they probably know what this is, but this is your diaphragmatic breathing. So what we're going to do, we're going to do 3 repetitions of breathing. I want you to close your eyes. I want you to feel every breath that you're taking. So again, proper posture first. Again, alignment, right? Are you guys ready? Let's go. Breathe in. Very good. And out. Into your nose. And out to your mouth. Smell the flowers. Last one. And blow your birthday candle. There you go. Now, the quick question is, which hand is moving? Is it the top hand or the bottom hand?
My bottom.
Bottom hand. Like, very good. So when you're moving in the upper, so let's reverse it. Let's just say, well, my top hand is the one moving. So it means you're using your accessory muscle. What that means is you are a shallow breather. So it's like, oh my God, I'm a shallow breather. No, you should, be mindful like, oh, so how do I change that? Just know that you have to use your abdominal muscle. All right. So when you're using your abdominal muscle, you're using your diaphragm, which is the primary muscle for breathing. So you're getting proper ventilation when you do that, right? So everything starts with a proper breath pressure. Okay. That's the first thing. And everybody can do that, right? So that's the first change you have to do. Okay. What about perch posture? Did anybody heard about perched posture? Yeah, what is this? All
No.
right. No. So it's basically how to properly sit. So as you can see, these are, very basic things that we can change right now. So I actually borrowed my son's chair. So to do a demo. So let me know if you guys can see me, okay? All right. Can everybody see me?
Yes.
Yes, perfect.
Yes.
Okay. So this is again a training of how you're going to correct your posture. So it's not like, the more you actually become more aware of how you're sitting, then the better you can make change on a daily basis. But do train, probably do this 10 repetition in the morning or before you even start working. Okay. So the first thing you got to do is a perch posture is a Tadasana. So that is a yoga pose. So the first is you have to make sure that your both of your feet are planted on the floor. So that's the reason why I chose Caleb's chair, right? Caleb is 7 years old. So usually if I use my husband's chair, my feet will probably be dangling. But one of the key things is make sure that your weight on the feet, okay? And this is something that you guys can follow through, okay? If you can do it at your own, at your own home, please do. Follow along with me. So make sure that your feet are actually touching the floor. And there's such a thing as a triangle of your feet. So if this is your foot, this is your heel, and these are your toes, the triangle starts from your heel. It's an inverted triangle. and then from the fifth toe, and then your big toe or your first toe. So imagine that, you have that balance between you're not leaning on the left, you're not leaning on the right. And there is actually a way for you to check. So if you have your left hand or your right hand free, try to imagine that go ahead and sit on your hand. Do you feel a bone?
Mm-hmm. Yes.
Right? That's your sit bone. So when you sit, that's the part of the pelvis that basically hits the chair. So usually what they say, the best way is go lean all the way back, lean all the way forward, and go midline, and try to find your steady pace. Okay. And then you're going to feel, that your lower back has a little bit of a curve, not arching like that, right? Like a little bit of a curve. Tighten that core, and then feel the balance on your feet. And then the last one is your head. I'm going to be facing neutral. I'm going to be facing forward. And I would imagine that I'm getting pulled again from my head like I'm a puppet. And then this is the best time you can do your deep breathing exercise. Okay? So this is a perch posture. It is advisable not to have any arms on the side. So your arms are actually laying on your lap when you do that. Okay? Good. So that's one. Hip hinging technique. So there is a picture about the hip hinging technique right there. So ADL adaptation, ADL stands for activities of daily living. These are things that you are functionally doing on a daily basis. So where do we apply this? This looks like a deadlift, right, Chris? So this look like a deadlift. So what this means is you are basically hinging on your hip. You're not putting too much weight on your, on your lower back. And that's what's going to save your back from if you're lifting weights or trying to pick up something from the floor. So it might be difficult to kind of do this. Like, where do I get, a dowel bar? Because that pole right there is a dowel bar. So one of the key things that we need to do is, if I'm going to hinge, I'm going to go ahead and try to touch the crease of my hip. Okay. And then when I lean, so I try to activate my core again. And then when I lean, right, you feel that, the bend is actually on your hip and not on your back. So that is one thing. So as long as when you're bending, you're actually feeling the bend from your hip. So that is hip hinging. So you're using the hip as a hinge. All right. So that is something that you basically, can practice at home. But if you feel like, wait a minute, I'm not even sure if this is one of the most common thing that my patient usually tells me, I don't even know I'm doing it right. So again, I'm here. You can always ask me, send me a video, send me a text, LJ, 2 minutes. Can you see my hip hinge? I can definitely, give you coaching for that. All right. So again, classic hip hinging when you're doing a sit to stand, right? Same thing. The dowel bar really is meant for biofeedback because you'll never know if are you really doing the hip hinge. So, it's basically 3 points. One is on your lower back. The middle part is supposed to be between your shoulder blade, and then the upper hand is supposed to be behind your head. So those are the 3 points that should be, aligned with the dowel bar the whole entire time. If at any point it's getting lifted either on the head side or on the lower back, you're not doing the hip hinging correctly. Okay. And this is one of my training ground, how to move a box, right? Sounds pretty easy, but this is the most common task that we do on a daily basis. So always remember do you remember the BLT, which is a spinal precaution? No bending, right? No lifting, no. So on a bone fit world, we never say no to any movement. We modify to make it safe because the BLT is a spinal precaution. So what it means is if you had surgery, then unless the doctor clears you for, doing all those sort of things, or, have a brace, then yes, definitely don't do them. But this is not meant for patient that has osteoporosis. The one thing is whenever you're moving, if you notice, he's not, do not keep your feet planted on the floor. Have you ever done where you're washing dishes or you're doing laundry? I remember doing this a lot of times where I have my laundry, pick up the laundry, turn
Mm-hmm.
and on the floor. I do that. And then that's when I realized, like, you know what? I'm hurting my back. So what did I do? I modify. I move the laundry basket right up top. So now I'm just shifting my weight and no more twisting. You can weight but avoid twisting. Okay. So if there is at any point any movement that you're like, LJ, I don't even know if I'm doing this right. There's like probably this stick of a book that, about modification. What we usually do is we ask our patient, give me 5 movements that you would want me to assess with you, right? And we can take it from there. Okay. So, if that is something you would want us to do together, by all means, send me an email. And then finally, of course, how do we move this forward? My favorite part is having a plan. There are 2 worksheets, and I will send you a PDF copy so you can basically copy all this. And this is knowing that every aspect of your exercise helps your bones to, to be stronger, right? So you just have to, have a checklist, right? So what I want you guys to do is, if you've been, you have any of this, if there are 2 activity plans, this is one of them that was recommended by the, by the Bone Fit program. What time of a day do you exercise? What are the things that you're targeting? If you notice, strength, we already covered posture, right? And then balance, and then aerobic. So you already know that on our next workshop, we're going to talk about either strength, balance, and aerobic. So I'm really excited about that. So we just touched base on posture today. Okay. Sheet B. And that is because it identifies your strength, posture, and then balance. And then the great thing about, like, so just a precursor with our next topic will be balance. I'm sorry, strength. Sorry. And this will be best for, for those who want to progress their plan, because one of the key things is, if you provide me your activity plan, we can basically review it. The average people, in terms of how is your physical activity, enough, or what are the things that you need to modify? Are you doing too much strengthening and not much balance? And are you also working on your posture? So the most important thing is we started to discuss posture. So start with that. Okay. And then finally, I always like to provide some resources. So if you want to learn more, most of the information that I shared with you is from BHOF, which is, where I got training from, and that's your Bone Health and Osteoporosis Foundation. There are also support groups that you can always go to. So when you receive, because your guys are going to receive the presentation. So, you can always click the link, and then it will bring you to the link for the BHOF. Okay. And the support groups. And then that is it. Thank you. So thank you so much for coming, because, at the end of the day, we are just one family, one community. And I think my goal really is to be able to share as much knowledge from that 24 year of being a therapist. And I'm just so blessed that, that I'm able to do that. And through you guys, whatever you learn from here, the only wish that I would want you guys to do is to share it, right? Remember, sharing is caring. So just share that information. And you might not know that you guys are changing lives. So it's always very important. So now we are on our Q&A. So we do have two. Okay. Can you share the link on how to get the fracture score for free? All right. So the fracture score, the FRAX, it's actually on your last email. There is a meeting link on the top. There is a FRAX score at the bottom. If you click that link, it will, get you to the FRAX score, the one that I showed you. Thank you guys. Yeah. So we're just getting started. No, I'm just kidding. So that's the end of the presentation. Again, if you have any questions that you would want me to discuss, or next topic will be about strength, which I'm also excited about. We'll be able to, do a little bit of strength training and strength assessment. So be ready to do a couple of sit to stand, right? So it's just a matter of knowing, am I lifting enough? Because the goal for bone fit, and this is a misconception of a lot of people, is, not to lift. The one thing that I actually forgot to share, right, is the Lift More trial. The Lift More trial, remember it was in the agenda. So the Lift More trial actually was back in 2018 through Watson et al. So what they did was they did a trial group for patients that already has osteoporosis. One is just a control group, basically doing their own thing, activities of daily living, already had diagnosis of osteoporosis. However, there was half of the group who had 8 months, twice in a week, 30-minute regimented exercise, group exercise. So they found out that those people who had subjected for that exercises, they were able to improve their DEXA score, both on the hip and on their spine. So that was just an amazing, that's the reason why they created the Bone Fit program, because of that study. So if you want to learn more about, I can send the link of that study. And yeah, I'm just excited about strength training, because that's one of the things that protocol number 2 that I actually teach my patient is the worst that a therapist, right? Wink, wink, hi, Eric, that you can do for a patient is to underdose, right? So if you underdose a patient, or if you're exercising and you're underdosing your exercise, there is a way for you to know whether you're underdosing or not. So it's just like I said, another thing about information. So I have how often, usually the DEXA scan, I'm just going through the chat. And again, thank you so much for your support. Just very happy that you guys are all here with me. That's more than enough. So how often to get a DEXA scan? It's really upon the recommendation of your doctor, but based on recommendation, it's every 2 years. And any post. Oh yes, for sure. It's posture pelvic. So usually what I would do is, if I'm doing a workshop, like a series of workshop for posture, I have another form of communication, and that's a podcast. Podcast is actually going to be this coming Friday. So I'm not really that busy, but anyway, it's coming this coming Friday. And I'm interviewing a certified doula midwife. So she has a lot of, information about that. So I try to, give as much information as I can. So yeah, most definitely. And then, yep, for sure. And again, have any questions, like I said, I'm more than happy to answer. But yeah, wait for, so you're definitely going to receive not just the presentation, but you're also going to get a recording. The other thing is, if you have anybody that would like to subscribe, so please just give them the link. And then I'm also in the process of creating newsletter that would address both the workshop and the podcast in written form. So yeah, trying to hit everybody with different ways, audio, visual, and then written. So all right guys, so thank you so much for coming. And again, I'm sorry for going over the time. I'll be more mindful next time. But for those who know me, I do talk a lot. But
thank you, LJ. It was
great. That was great. Thank you so much.
Great job.
Good job. I loved it.
Great job.
Appreciate it.
Yes, very
Yes.
Great job.
very informative. I'm looking forward to the next one.
Oh yeah, same here.
You're a busy
All
girl.
right, guys. Have a good night.
Have a good night. Bye, everyone.
Bye.
Good night.
Bye.
Love you.
Love ya.
Bye.
Yeah.